Welcome to the press briefing. We have Dr. Chuang Suk Kwan from the Center for Health Protection. She's the head of Communicable Disease Branch, and Dr. Lau Kah-hin, Chief Manager, Hospital Authority. Dr. Chuang will first give you an update on cases. Good afternoon. Yesterday, we have 12,040 positive cases from PCR test and 14,868 RAT positive cases. In total, there are 26,908 confirmed cases. The total number of cases in the fifth wave of epidemic is 623,044 cases from PCR tests and 98,110 confirmed cases from RAT. Among the 12,040 PCR positive cases, 1,545 reported by the Hospital Authority, 2,113 cases identified by the Public Health Laboratory Service Branch, and the remaining 8,382 cases reported by private contractors. Among the Public Health Laboratory Service Branch cases, one is test positive for L452R for 436 cases. We couldn't find L452R. That means there are Omicron cases, and for the remaining 1,670 cases, either the result is pending or the viral load is too low and sequence analysis cannot be done. And as at early morning 00 hours today, there are 4,066 cases, 4,557 death cases from at the Hospital Authority, and 9 cases of death are outside the Hospital Authority. I'm talking about the figure for the fifth wave. And there's an additional 286 cases of death. 249 cases involved those who passed away yesterday. And the age range is 11 months old to 122 years old. 1,559 females and 2,507 males. Residential care home residents for the elderly and the disabled, that's 59% of the total death cases. And then 95.95% of the death cases involve those aged 60 or above. As for those aged 70 or above, they account for 86.9% of death cases, and for those aged 80 or above, they account for 70% of the death cases. The fatality rate is 0.56% overall. For those aged 80 or above, the fatality rate is 9.44%, so it's much higher. That means the elderly group is a high-risk group. For those who've been vaccinated, the overall fatality rate is 0.08%, so it's much lower. For those who have not been vaccinated, the fatality rate is 1.86%. So that's a difference of over 20 times. For senior citizens who've been vaccinated and who've not been, the difference is for those who've been vaccinated, the fatality rate is 2.89%. For those who haven't completed vaccination, the fatality rate is 12%. Yesterday, we received a report of cases from 11 residential care homes. 4 are from homes for the disabled and 7 from homes for the elderly. There are a total of 46 home residents and 2 staff members. So far, there are 270 residential care homes for the disabled and 752 residential care homes for the elderly that have been affected. So that's 80% of RCHDs and 90% of RCHEs which have seen at least one case. In total, 3,434 3,370 home residents were infected and 9,263 staff members were infected. So that's about 30 to 40% of the total number of home residents. As for staff members, that's about 22% of all the workers at these homes. So that's all from me today. Thank you. Dr. Lau, please give us an update on the hospital authority cases. Good afternoon. We have 9,905 confirmed and preliminary positive cases in public hospitals, North Lantau Hospital, Hong Kong Infection Control Center, Hospital Authority Infectious Disease Center, and the AWE Community Treatment Facility. Yesterday, 91 patients reported to be critical, 102 are in serious condition. 104 of the critical patients are now in ICUs receiving treatment. As at 00 hours today, in the past 24 hours, 249 COVID-19 positive patients passed away. 151 males and 98 females. Age is between 39 and 102 years old. Among the 249 patients who tested positive for COVID-19, there's some analysis. Now, 134 of the patients came from homes, about 53%. For those with no vaccination record, they accounted for 165 patients. For the remaining who were vaccinated, 41 had 1 dose, 39 had 2 doses, and 4 patients had 3 doses. For elderly aged 65 or above, there were 231 of them, more than 90%. I would like to give you a bit more information about the relatively younger patients who passed away. First, a 39-year-old patient. Now, this patient had cancer. Then there's been metastasis of the cancer. So that patient was chronically ill and was receiving cancer treatment. Another 40-year-old patient, that's some sort of hereditary disease involving the metabolism of iron. The patient did not see a doctor for many years. When the patient was admitted, there was some extent of liver failure. The condition deteriorated. The patient was then admitted to the ITU, and at the end, the patient passed away, unfortunately. And then there's a 52-year-old patient who had problems with chromosomes. And then the patient had stroke, epilepsy, and hepatitis C. So the patient was chronically ill, living at a residential care home for the disabled, and the patient had to be tube fed. Another 53-year-old patient who had hereditary issue with degeneration. Although the patient was only 53, the patient could not really speak, couldn't communicate with others, so it was also a chronically ill patient. Next, another 54-year-old patient who was a cancer patient. Again, there's been metastasis to various parts of the body, such as the bone and the lymph nodes. And then the patient was taking anti-cancer medication. And of course, such medication would suppress the patient's immunity system. Now, a 7-year-old patient with blood that spread to the lymph nodes. The patient was on medication and was a chronically ill patient. Another 57-year-old patient with some thyroid problems, and in the spleen, a tumor, probable tumor was found. The patient had been seeking consultation, and that's some liver cirrhosis. So again, this is a chronic KO patient. Actually, the tumor was found on the pancreas, not spleen. And then another 57-year-old patient with cancer that's metastasized to the liver, lung, and lymph nodes. Finally, a 59-year-old patient. The patient was mentally handicapped, staying at home. The patient also had epilepsy. Now, because of backlog of data, we would like to report the number of death cases between the 27th of February to the 12th of March. There are 37 death cases, 27 male and 15 female, aged between 14 and 106 years of age. And in the past day, 375 patients have recovered and been discharged. And 40 patients tested positive for COVID during admission screening. About 50 other patients in the same ward listed as close contacts. For staff members, so far 15,227 staff members have become confirmed cases. 6,948 have recovered and returned to work. And on adding more designated outpatient clinics. Tomorrow, the hospital authority will operate another 6 designated clinics. So in total, there will be 23 designated clinics. So for patients who have mild symptoms but who need consultation, and who's staying in the community, they could go to these clinics, especially for those with high risk. Hopefully, then we could provide them with appropriate treatment in response to their symptoms. For these 6 additional designated clinics, that's the General Outpatient Clinic Wang Shui, Wang Tao Hom Jockey Club General Outpatient Clinic, Lam Tin General Outpatient Clinic, Shakib May General Outpatient Clinic, Cheng Yi Town General Outpatient Clinic, and Yu Fengshui Health Center. Now, patients must first make an appointment because we don't want people to gather while waiting. For these 23 designated clinics, we have already a booking phone number, but tomorrow there will be another phone number, which is community care hotline, dedicated hotline. This is for those with high risk to make appointments. We will be issuing a press release on the list of designated clinics. Thank you.
Questions, please raise your hand and use the microphone we pass to you, and please identify the agency you represent. This gentleman in the last row. Good afternoon. Orange News. CUHK projects that perhaps 5 million people in Hong Kong have already been infected, and we have to wait until end of May or early June before we can see 4-digit infections per day, and then we have to wait until end of June before or early July before we can have less than 100 per day. So what is your comment on such projection? And Dr. Zhang said that there was a Delta case detected. Does that mean that there is still a silent transmission Delta chain in society? And talk about the fatality rate. There has been a rising trend in the last 2 days. I'd like to know the reasons for that rising trend. Do you expect that the fatality rate will continue to climb? I understand that both universities would have some mathematic analysis using mathematical model to predict the trend. Of course, we will consider Hong Kong U's prediction. And we also have to look at the actual figures to see whether the trend aligns with their prediction. And we also have to consider the people flow in society. Some have said that there seem to be more people moving around in the community in the past few days, and that will have an impact on the state of infection. Now, the figures, the daily figures are still high, and they have not dropped or improved. So I hope we can all adhere or observe good hygiene and reduce going out as far as possible. Yes, we have got one L45R2, 452R. It's not that we have tested all samples. We can only analyze samples left with the public health laboratory. So perhaps there are still some minor outbreaks of Delta in the community. When it comes to the fatality rate or mortality rate, I think we have to consider the time of death. Some cases may be confirmed now, but the death rate will be reflected at a later stage. So we have to observe a longer term. Now, for the previous 4 waves, we could only conclude the fatality rate after those waves have ended. So we have to wait a bit longer. The gentleman here, I'm from Phoenix TV. I'd like to ask about the number of imported and local cases respectively. And we are relatively stable in terms of the number of confirmed cases. I'd like to see whether there is a rising trend in the number of discharges. Are there figures to show that the number of critical and serious cases are lowering? There are many people tested positive with RAT, and after completion of home isolation, they feel that they've already got the 8 antigens and they feel comfortable eating out. Does that mean that once you are recovered, you can lower your guards? Actually, after how long will a person be reinfected again? I forgot to say that we don't have any imported cases today or our local cases. This applies to everyone. If it is a recovered case, one has to take care of his health and should be careful to avoid spreading the disease to another person. According to WHO, for a recovered case, generally speaking, the case of reinfection within 3 months is low, but of course just a general guideline. But individual cases may vary. In general, the protection is about 3 months. For discharged cases, I think the numbers are roughly the same. We have to ensure that patients are physically stable before they can be discharged. In this way, we have more elderly patients and some are chronically ill and they may take longer for recovery and need treatment in hospital. That lady in red, I'm from Now TV. I'd like to ask about the death cases. Now, there was a case of 11-month-old. Can you elaborate on that? And there were 9 cases of death outside hospitals. Can you elaborate on them as well? Recently, we have cases who passed away before hospitalization. Were they waiting for a placement to treatment or isolation facilities, or did they have they sought medical help at all? Does that mean that when our healthcare system has broken down, we have to sacrifice those who are waiting for community isolation facilities at home? And it is said that if all the designated clinics are full, then people can still get prescription at designated clinics. I'd like to know the arrangement. For Ratchangi Hospital, and Haven of Hope Hospital and Fung Yu King Hospital, they're going to be converted to COVID hospitals. What is the progress? Perhaps I did not make myself clear. I said the age range was from 11 months to 112 years old. That is the whole the fifth wave. So we already gave an account of that case. It's not that we have a new one. And so these cases were announced previously.
You asked whether patients passed away while in hospital or before they were admitted to hospital. Now, we don't have the figures at hand. As you know, we are actively increasing the number of beds. This morning, our chief executive of the hospital authority said that we have now over 10,000 patients for COVID-19 patients. And of course, designated hospitals play very effective role, because then we'll be able to take in patients as soon as possible for treatment. And then now we see that at the accident and emergency department, there's no need for patients to wait. So hopefully then they could be admitted sooner. For designated clinics, we are fully aware that there are certain patients who need to seek consultation, and then they may have to make calls to make an appointment, same as other patients of high risk. Now, for the high risk groups, such as those who are older than 70 years and or young children who have a weak immunity system, and then for others who are immunosuppressed, say because they're taking anti-cancer drugs and so on. Now, starting from tomorrow, we will have a dedicated telephone number for this high risk groups. Is called a community care dedicated hotline. So for people aged 70 or above, children under 5, or pregnant women in at least 28 weeks, or the immunocompromised patients, or others who are on long-term medication that leads to suppressed immunity and so on. Now, these people could use this community care hotline to make appointments at designated clinics. Hopefully, the high-risk groups could get treatment as soon as possible. This will reduce the chance of them deteriorating into severe conditions and that require hospitalization. The gentleman there from cable TV, I want to ask about designated clinics. So you have this community care hotline now, but before this, many in the community are saying that it's impossible to get through the telephone. So are you adding more people to answer calls, and what is the phone number for this community care line? Second question, this morning there was mention about mainland medical teams coming to Hong Kong. Now, say when they are treating COVID-19 patients and there are any events or accidents, unfortunately, then who will be held liable? Would it be the Hong Kong SAR government or who? So who will be liable? And then now another question on oral medication. It said that a priority will be given to the elderly and the chronically ill. Under what circumstances would the drugs be prescribed to them? Would they have to fulfill certain criteria before they could be administered with this drugs? And do you have a figure on the number of prescriptions made so far? Now, the experts saying that the cases remain high, but though they have plateaued. But what is your assessment? Do you think there's a chance of rebounds of cases? About the community care line, is not really just a single phone number, because every clinic has a dedicated community care line. It's when you call a clinic, it's the same at every clinic. So when you call the clinic to make an appointment, everyone will call the same number, but there will be a dedicated line for the high-risk groups I mentioned. If they feel unwell, we hope that it will be easier for them to get an appointment so they could see the doctor sooner. And if necessary, they could be prescribed with medication. We'll be issuing press release later. We'll give you the phone number of the community care line for all the 23 designated clinics. About mainland medical teams coming to support us. For this wave of the epidemic, we're seeing an increase in the number of confirmed cases. The situation is dire. You can see there are many people making use of our healthcare system. In terms of both hardware and software, we are really stretching our capacity, and in some occasions, we're hard-pressed to cope. So now, with the support of the mainland, we have built many facilities, but facilities need to be staffed by manpower. So we need manpower resources. And so we very much welcome mainland medical teams coming to Hong Kong to support us. And with their support, we believe we could boost our capacity to admit and treat patients, and there would be a synergy effect achieved. This morning, Dr. Koh mentioned that this afternoon, some 70 plus mainland experts will arrive. And in this week, there will be another 300 arriving at Hong Kong. In fact, before this, there are already a dozen of mainland experts who came to discuss with us the very issues on collaboration. So, actually, the hospital authority of doctors will work together with the mainland experts, so we could then achieve the best result by leveraging of everyone's expertise. Sorry, speaker is not using microphone. Sorry, speaker is not using a microphone. Well, we are all experts. We wouldn't say who is the chief, who is the deputy, but rather we collaborate and work together. It is often the case in Hong Kong. Let's say in a hospital there are different patients, and maybe we would collaborate with doctors from different hospitals, or even with doctors from private hospitals, because we want to achieve the best clinical outcome in treating patients. As for the mainland medical teams coming to Hong Kong, of course, they will be given exemption, as you know, from certain statutory requirements. And the hospital authority would work with them on all fronts. Hopefully, then we could see the best results. On medication, this morning, it was mentioned that we have two drugs. One is the molnupiravir of MSD, and the other is Paxlovid from Pfizer. Both are oral medication. For molnupiravir, is already in Hong Kong. Actually, almost all of the drugs we've ordered are here, and we started administering the drug. So far, doctors say that the efficacy is rather good. The other drug will arrive this afternoon, and then we will be administering this drug at different places, in hospitals, designated clinics, and homes for the elderly. We actually go by guidelines drawn up by experts. The guidelines cover clinical scenarios and under what circumstances we should administer the drugs to patients. Apart from administering the drug, so doctors will have to see whether the drugs are right for the patients, where they have to explain the side effects and so on of the drug to the patients. The aim is to prevent the condition of patients deteriorating from mild to serious. Perhaps Dr. Chuang could respond to the question on the epidemic. Let's Dr. Chuang respond first.
As far as the epidemic is concerned, I think it is quite a valid description to say that the number of cases has plateaued. But if we have all lower our guards and if there are too many people in the community, then there is a risk of a rebound. The lady in the last row.
P News. There was a CHK study earlier that estimated that only 30 to 40% of patients will report their positive cases to the government. May I ask if you feel that the figures are indeed of the figures of people reporting themselves positive are indeed underestimated? What more can be done to encourage more people to report their positive cases to the government? Can I also have a breakdown on how many people tested positive between February 26 and March 5 and reported their positive cases to the RED platform? And my last question is on the one Delta case. What do you make do of that one case? Do you see chances of more Delta cases coming up in the future? Thank you.
I do not have an exact estimate of the number who has not reported to us through the platforms, but I will urge the public to report positive cases to us so that we will understand the actual situation in the community. And also, I do not have the exact figure for those number of cases reported through our platform in February 26 to 5th of March. But we will collect this data by the end of today, and then we'll summarize the data afterwards.
頭先我嗰個記者朋友問嗰個定點醫院，我補。
That journalist asked about our designated clinics. Let me supplement. Designated hospitals. Now we have got a few designated hospitals for COVID patients, including Tin Shui Wai Hospital. We've got 300 beds. Northland Town Hospital, 160 beds. 1,300 beds from QEH. Tongwa Grove Hospital, Feng Yukun Hospital, 260 and 250 from Ratanji, and also 250 from Haven of Hope Hospital. And then in other hospitals, some general wards are being already converted to receive COVID patients. That gentleman, that lady on the other side. I'm from Dot News. The first question is, the central authorities have given full support for Hong Kong's fight against epidemic. Supplies such as medication and face masks have been provided. Since many people are being isolated at home, they need a lot of supplies. But many people are saying that the government's progress is too slow. What measures can be taken to help the confirmed cases so that they and their family members can feel at ease when isolation at home? And then there were a case whose condition worsened during isolation at home. The case tried to call the government for a long time to no avail, and they had to wait for 24 hours before an ambulance could arrive. Starting from tomorrow, we will have 23 designated clinics. Do you have figures to tell us on average the number of attendances available for patients in each clinic? Yes, I know, because there's been a rapid surge in the number of confirmed cases. So the delivery of supplies to confirmed cases may be a bit slow. Government departments have done their utmost and they have tried all sorts of means. They're trying to identify more logistics companies and teams. Hopefully, we can boost our capacity to deliver supplies to confirmed cases at home. Now, for designated clinics, we have got 17 and providing 3,000 attendances per day. Checking my records, most of the slots have been taken up. It's hard to say the capacity of each and every clinic because they are of different scale and they have different number of consultation rooms. After we have got 23 designated clinics, we can provide over 4,300 slots per day. On the far end, I'm from Hong Kong 01. we receive information on the case who on the 23rd of February was tested positive by RAT. However, the RAT platform would only require those tested positive after the 26th or after 26th to be reported. So she reported the case, but she did not receive any SMS. She had only received one dose of vaccine. She needs exemption, a certificate for exemption of further vaccination, but because she hasn't got any SMS, so she cannot produce a certificate of a confirmed case, and the time for her second dose is imminent. How can she get any proof that she was confirmed? Now, if a person has only got one jab, and then the case was tested positive on the 26th of February, yet chose not to report to the platform. Does that mean that the case could not get any certificate of infection and exemption from vaccination? If after recovery, a patient or recovered patient take another jab earlier, then the time frame will the case health be affected. As at now, we only receive reports tested positive on or after the 26th of February. Previously or prior to that date, a PCR result is needed. So if the case has not been reported to us, we cannot issue a certificate of infection using a PCR test. So if I hope the case will not receive a jab earlier than the prescribed time just because the case wants a certificate of vaccination. Our advice is a recovered patient should receive a jab 3 months after recovery. I'm from TVB. In Chiwonsan Teaching Chin, 69 person fainted at home. I'd like to know when he was confirmed. Was the case reported to you? Given that there are so many community isolation facilities, why are there so many confirmed cases not sent to isolation? Now, to follow up on the question asked by another colleague, now, should there be a medical incident related to a member of the mainland medical team who should be held accountable? And what about insurance matters? And as for a vaccination for a recovered patient, so after 2 jabs, if on the 7th day after tested positive, it is still positive, then what can be done? Because if it is a negative case, then the case can then be released. So if on the 7th day it is still a positive result, does that mean that the case should go for a PCR test? Let me take the question about PCR test. Now, we require a person to carry out an RAT on the 6th and the 7th day if on both occasions it's tested negative, then it can be released. RAT is different from PCR. A person who has contracted COVID in general may still be positive in PCR for a while, for 2 to 3 weeks and even longer. That doesn't mean that the case is still infectious. It's just that there is still residual virus in the case body and is picked up by a very sensitive PCR test. That doesn't mean that the case is not recovered or has been reinfected. It does happen. So these things do happen because we previously required patients to stay in hospital until their PCR tests were positive. But we understand that once and 1 week or so after infection, a case is no longer infectious. So it depends on the company's requirement, whether the company requires a negative result or isolation after 7 days.
On mainland medical teams coming to support us, we do realize that we are two different teams, and that's time. There's need for the two teams to, work out issues and work closely with each other. Now, we already had discussion with mainland experts in the past week on drug administration, treatment protocols, and so on. There's been much discussion, and we will be working on a collaborative model with the mainland teams. So with clinical